We are live with Doug Turner, who is the organizer for Informed Choice Washington of this event, COVID Betrayal, a Path Forward. And actually, Doug, our topic, as we have discussed and people know, is going to be about, at the beginning anyway, we're going to talk about a lot of stuff, but how Washington State literally just ended contact tracing, which is hilarious to me because it's like forever ago that they started it. I didn't even know people were still doing that. But I wanted to give you a quick second at the top of this. Let's talk about COVID betrayal. All right, what does that mean, COVID betrayal? And then we can talk about the path forward a little later. But what is this event? Which I should tell people, the link's in the description. If you want to go to it, you're in the Eastern Washington area, you can go check it out. It's in Spokane. What does that mean?
Well, I think the word betrayal refers to a number of different levels, primarily with the origin of the virus, gain of function research, the players involved, they're working on this, why they're working on it. That's one side. Obviously, the virus itself, the government and public health response to the virus, and so we can talk about the betrayal when it came to the suppression of information regarding the masking, the utility of masking, regarding the full disclosure of the risks from the vaccines, regarding the pressure that people faced with their jobs, with their livelihoods, their businesses, school children. Betrayal, we thought, was an apt word to capture the full spectrum of costs that were induced by what we feel to be unfair government and public health policies in response to this virus.
Okay, to me, I was just looking up the definition of betrayal. It's a violation of trust. So it implies that people should trust the entities that you just named. I kind of feel like it's a good thing at this point that people are like, I don't know if I should trust the powers that be anymore. What do you think about that? I mean, do you feel like it's a good or a bad thing that people feel betrayed? I mean, I guess to me, I don't really feel betrayed because I sort of expect them to behave this way. So they just confirm my expectations. I'm like, okay, government does what government does. That's why you always got to keep an eye on them. What do you think about that?
No, I think you're right, and that's why we chose the word, because it does go back exactly to what you mentioned, which is trust. And people have placed a tremendous amount of trust in the past in our government institutions, our public health institutions, and we can go down the list, whether it's education, higher education, HR departments. we are a society that respects authority. And we are taught from an early age to obey the rule of law. And the assumption is that those powers that are being exercised are on our behalf. And sadly and tragically, what we've learned over the last 3 years in spades has been a betrayal of that trust along the lines of what I alluded to earlier. So betrayal equals a lack of trust, and that's what we're pointing to with this event.
Okay, let's go to the topic at hand real fast, shall we? So I was on a media call, which I'm going to play for people in a second. My question, I got a couple questions from my supporters over on Locals. Remember, you can join my editorial board at AllisonMorrow.locals.com and put in questions ahead of time for interviews. So I got to go one-on-one with the Department of Health for Washington State. I asked them why their charts show, they showed their charts that the highest hospitalization rate for COVID, hospitalization, death, and, being hospitalized with, serious complications with COVID came in the months after the vaccination campaigns rolled out. And I was just curious, like, what was going on? And you'll see their answer. You'll see their answer in a second. But let's talk about contact tracing, okay? Case investigations, contact tracing. They just finished this. Do you remember the details of this program?
Vaguely. So please go ahead and try to set the table for us. I'm familiar with the basic time frame and the purpose, but in terms of the implementation, the chain of custody, if you will, behind the contact tracing, that I'm not familiar with.
Well, let's just read a couple of the frequently asked questions, okay? What is contact tracing? Contact tracing is a way to identify people who may have been exposed to COVID-19. Contact tracing helps public health track and prevent the spread of COVID-19. What is a case investigation? A case investigation is part of a process to support people who have confirmed or suspected COVID-19. Okay, what does that mean to support them? How can I be confident someone who calls me is actually from public health? Now, that's a great question. A legitimate call from public health will start with questions about your name, address, and date of birth. I never get those from anybody else. A case contact tracer will never ask for immigration status, your social security number, financial information, or tell you who may have exposed you to COVID-19. If anyone asks you one or more of these questions, hang up without providing any information. How does public health know when a person has COVID-19? By law, doctors and labs must report positive cases of COVID-19 to the local health jurisdiction. A trained contact tracer then reaches out to the person who tested positive to start a case investigation. And then basically how I understand is they interview, see, like, what do contact tracers need, or why do they need to interview people, or what are the steps in contact tracing? This just shows how it works. Here's the PTF. Okay. Trained interviewer. So basically your health information becomes public record. And then a trained interview, I mean, it becomes public record for the government. They're not supposed to, give it out or whatever, but okay, they get to know, which is crazy to me. Anyway, that's my opinion. But a trained interviewer will reach out to the person who tested positive. So they're going to call you. And okay, again, they're not going to ask for your social security number, immigration status. All right, participation is voluntary. Great. A close contact is a person who has been within 6 feet. So they're going to ask you, who have you been in contact with the last 6 feet? And then you're going to tell them all these people. Okay, then the interviewer is going to call all those people and let them know they've been exposed. And then do they ask them, well, who have you talked to? Who have you been hanging out with? And then contact stay home to watch for symptoms for 14 days after they were exposed. So that's the idea. Then all these people that you talk to, they want you to stay home for the next 14 days. If a contact tests positive, the process starts over again as a confirmed case. And going back to the whole question about why do you have to be interviewed, I thought that was really interesting. Let me see. What are something? Why do contact tracers interview people? Okay. Identify close contacts who might become sick, give information about how to stay safe, help people check for symptoms, connect people with resources to safely isolate or quarantine, stop the spread of COVID-19. Now, a lot of this is written in a way that I think a lot of people might go, oh, that's great. We're going to stop COVID-19. But people like me are like, this just feels like a total rabbit hole to go down for like medical privacy, like losing medical privacy. I don't know what you think about it. We haven't talked about this, but my opinion was like contact tracing was, I don't know, raise the hair on the back of my neck, if you will.
Yeah, I agree with you. It's another symptom of the mentality of the state acting through administrative partners to exercise a degree of authority and power over the American people that is unprecedented. The infringement on our liberties, it gets back to that earlier conversation we had regarding why we chose the word betrayal, and that the close tie with trust. And the action of contact tracing violates a number of heretofore sacred ground that the American public, based on our ideals, have chosen before not to travel. But when you peddle fear and you suppress information, you suppress dissent that provides a counter to the official narrative, then all bets are off. Then it becomes much easier to control a population, to induce fear, to allow for everything from masking to experimental gene therapies in the name of vaccines to contact tracing. And it is a steady descent into a very problematic and dark place where we have allowed measures to be taken ostensibly on our behalf. But with the suppression of information, people don't have the ability to find a counterfactual and to understand what the costs are to contact tracing, what the breaks are concerning medical privacy, how well these interviewers are actually trained, where this information is being stored, how it's being communicated, how it's being shared, and ultimately what the purpose of contact tracing is. Is it really effective? I mean, these are the types of debates that a free society is designed to go through, and that was short-circuited.
So what do you make of the fact that Washington State not only did it, but just stopped it 3 years later?
Well, I think it's predictable behavior from a bureaucracy, from a centralized authority. They're not quick to provide any mea culpa. They're not quick to provide any after action report. If they can't come clean and simply state that we acted in a manner that was unbecoming, that was ineffective, that violated rights. We did it for all the best reasons, and we have discovered that it wasn't necessary, that it did not work. That's not going to be something you're going to get from any bureaucracy, be it public or private. They are going to circle the wagons. They're going to deny. They're going to ignore. And they're going to move on. And this goes to the question of accountability, which gets back to forums like we're offering on Saturday to try to provide some missing pieces, to remind people of what we've been through, and to organize in a manner that can help us provide some protection against something like this happening again.
I was just looking up this. This have you heard of this? Mass warrantless surveillance ends Section 702. This Courtney's asking this. Will you guys be talking about the FISA bill, Section 702, that's set to expire in Congress this year? I'm not planning on talking about that today. However, I'm happy to bring somebody on to discuss it, but I will just throw it at Doug. Doug, are you familiar? Do you want to say anything about this? I mean, just as ramp up the surveillance conversation a little bit real fast.
Yeah, well, we can go down a rabbit hole here, and I'm certainly not an expert on this. I think we can speak broadly. And I think it ties in very well to what we're talking about regarding public policy regarding COVID. Look, we've suffered a massive loss of credibility in the so-called administrative state, which includes federal law enforcement, which includes the FISA court system, the ability to conduct surveillance on American citizens. We saw the corruption of that with FISA judges. We now know that the pretext that was stated in front of that courtroom was false. But again, for many of us, this is old news, and it ties into whether it's public health officials, whatever the policy might be, whether it's law enforcement, whether it's public health. There is an absence of accountability when wrongdoing is discovered. There isn't any accountability. There's no price. There's no penalty. There's no public denunciation of the action that was taken by that particular judge, by the FBI agents in front of that judge, and life goes on as normal. And that is what is making people very frustrated. It's breeding a disaffection with the electorate in terms of our voting. And that's another symptom, I think, of the lack of transparency, a lack of accountability in the administrative state, and specifically to your question regarding the FISA courts and the FBI, the evidence that the FBI presented in front of that FISA judge. But again, it's widespread. This public corruption, this lack of integrity, this lack of allowing the American people to see behind the curtain what's being done, and actually to influence these agencies regarding disciplinary action for bad players. And we don't need to paint with a bad brush here, but when something goes wrong in your family, in the private sector, there is accountability. And we are not seeing that with our public institutions.
Doug, you did way better on that question than I thought you were going to do. I'm glad I asked. Well, I wasn't sure. I don't know. I'll just ask him and see what he says. Thank you. It seems somewhat relevant to topic at hand, but didn't want to derail the conversation. No, it totally does, because the reality is the state governments take their lead from the federal government. And, like my old boss, Hillary Franz, who's now running for governor, And, I was fired by her administration for this podcast. She took her lead from Jay Inslee, the governor. So it's like the state agencies take their lead from the governor takes his lead from the federal government. So yeah, I mean, if there's a culture of anti-privacy or a culture of unconstitutional government action, everyone thinks they can just get in on it. No one's gonna come after us, or at least only a few people can afford to sue. Then why not? You fly under the car. It's kind of, in a way, it's kind of the way that the media works with their inaccurate reporting. It's like if everybody says the wrong thing and only a couple people say the right thing, who's right? The way it works in the media is like, just go with what the wrong thing is that everybody's saying, because it's safer. You're less likely to get sued. And I had people say to me, like, just say what NBC says. Well, do we know that what NBC says is right? I mean, just because we're the NBC affiliate and we just recycle their information, I mean, that doesn't sound like, just say what they say. But that was the cultural attitude. And I do think that, it does apply. It does apply to what we're talking about in Washington State for sure.
Well, I completely agree. I think your background as a journalist, you can speak to this directly. Why did you enter the field of journalism? My hunch is, I'll let you answer that question. I'm gonna put some words in your mouth here, but my take is that idealistically, people enter journalism to explore, to get to the truth, to provide two sides of the story, to treat people decently, and listen, and on that search of exploration to discover, based on the story and the facts that are gathered, to arrive closer to the truth. So I really want to kind of maybe turn the tables on you, Allison, because obviously this is a big piece of the COVID. We might call it a biomedical fascist state. Those are lots of buzzwords that are highly emotionally charged. We've touched on the surveillance state somewhat, but journalism has played a huge role in this. And with your background as a journalist, I'd like to ask you the question, why you entered journalism and why you chose to go on a private platform away from a large institutional organizational employer.
It's a long story, but I guess short. Why did I go into journalism? Besides the fact, I guess I'm just nosy and I like to I like to see things for myself. I think I was just talking to somebody the other day about this. Because she was asking me if I got in trouble a lot as a kid. I never did any drugs, but I did get into a lot of trouble. And the thing I got in the most trouble for was I was an anti-authoritarian, I guess, as a 12-year-old. I don't think my math teacher would have seen herself as an authoritarian, but I mean, I think I was one of those kids, I think, who never just said, "Oh, you're in a role of authority, so I should just trust whatever it is that you say." Like you had to sort of earn it with me. You know what I mean? Like, and I'm not saying necessarily that I was always right to be disrespectful and talk over my math teacher. I'm just saying I always had that side to me. I was always a little bit skeptical of the people in power, whoever they were. And I wanted, I just wanted to pull the curtain back a lot. And I think originally I wanted to go into, I was like really into like kind of show producing. I like to, I like to have a lot of fun. I'm not as serious as I think I come across in this podcast. I've done some comedy sketches on my channel. I think that people are like, "Whoa, Alice," but I joke a lot. I have a sense of humor. I'm not as serious as I think a lot of people think all the time. And so originally I was thinking I wanted to do a morning show. So that's how I got into producing for Fox News Channel, because I got to be on the morning show and we did a lot of fun stuff, like all kinds of weird, soccer games on 6th Avenue and just crazy weird stuff. But over time, I think my personality got more and more. I mean, maybe I learned more because I was becoming an adult and I started caring more about what was going on outside of having a band Friday morning or cooking show or something like that. And I wanted my life to go towards something a little bit more, I don't know. And I didn't put two and two together. So I went to graduate school to get a Master of Divinity degree because I thought I was then going to be a counselor. I think that the thing that they have in common is that I was interested in people's stories, like understanding how people think and like what's really going on. And I like working with people. Like I like listening to people tell me about what's going on. Now, over time, I decided I didn't want to see my clients every day, or like every week for years. I was just like, this isn't for me. So I had a preaching professor who got me starting to think about like, what is like the bigger purpose of journalism, I guess. I tried to get out of preaching class, but they wouldn't let me graduate. And so I had to go take preaching, and my professor was the one who kind of won me on it, because he made me realize that the role of, you can go out and just be an anti-authoritarian, I guess, but what are you building? If you're just tearing things down all the time, like, what are you adding back to society? And that there is this role for the person who is questioning and is skeptical and likes understanding like how the world works, to be kind of the middleman between finding the information and delivering it to the people who couldn't be there on the front lines of what was happening that day. And that I realized that there are people whose egos, and hey, listen, I got one too. And I'm not going to try to say I was perfect all my career. I've talked many times about how many mistakes I've made. And because in a lot of ways I trusted the system, that now I realize, wow, I was really I was blind to a lot of this stuff. I was blind to how thick the propaganda is and how often reporters are used by government and special interests in order to push a message. But at the time when I started to get in, I think I really believe that, as a reporter, you had a choice. Like, you could use this information to try to control, you could control behavior or make things worse, try to just, I don't know, just get everybody, I don't know, riled up and just at odds with each other and just use it for ratings. I realized that was part of the game. Or, you could, whatever the truth did, wherever it led you, you weren't attached to what would happen. Does that make sense? Because I think the part of the problem is, I will just tell you what it is. What I think is one of the biggest problems in journalism right now is people see through the filter of the society that they believe should exist, or they want to exist. They're like, well, we think, we're scared that all these people are going to die of COVID. So we have to tell you what's really going on from our perspective. And we have to block any information that challenges that, because otherwise we're going to kill you. And we have to have this kind of society. For me, it's like, I would rather tell you the truth. And you know what? If the world implodes because of it, oh, well, maybe that sounds insensitive, but I don't, I was doing a live stream for my editorial board on Locals the other day, and we're talking about birth rate and stuff, and people saying, oh, that the United States is going to be able to continue at this low birth rate or whatever. And, I'm looking at I'm interested in this topic, but I'm not really interested in the topic because I'm trying to necessarily save the United States. I'm interested because I want to know what the truth is. What's going on with people? Why do women not want to have more kids anymore? What's going on there? What's up with families? What are we being told that we should look like, or we should be like, or what, all that kind of stuff is interesting. It's not because I want to get information out in a way to save anybody, or that am I making sense? I don't want to keep going down that rabbit hole, but that's my story.
No, that's really good. You touched on a lot there. There's a lot to unpack there. You went to divinity school. I did not know that about you. But as a young person, to go to college or to travel, decide whatever you want to do after high school, the sense of adventure, building a sense of meaning and purpose, is critical. And it's easy to get off the rails if you're at Oberlin or Gonzaga. It's easy to we admire professors, we admire scholarship and learning. When you're only getting one side of the story, it's easy to understand how powerful ideas are and how they play out in HR departments, let's say, around the country, and how these ideas that are learned at the university level play out and have consequences. And for you, I think it's fascinating to hear. I'd like to hear more about your experience in divinity school. But to get back to our conversation, truth needs to be defined metaphysically. It can't just be in the eyes of what we think is true, what we think is good. There has to be a higher order. And unfortunately, we've divorced ourselves as a society from understanding what truth is, where it comes from. Hence, we're in a position today where every institution has now fallen under a high degree of suspicion, which gets back to our original conversation regarding betrayal and trust. And how do we get it back?
Yeah. Well, and one thing I talk a lot about too with people is, how do you move past the experience of what we have seen without resentment and rage fueling your choices, because I think that is a path to destruction for the person who, yes, all these things that we've talked about may be evil at the greatest level. I can't say because we're live on YouTube. If you want to see what happened to the kid of the parents that I just interviewed, then you'll have to go to my other platforms. We didn't do it live on YouTube. So if the evil that's out there is real, it's of the deepest spiritual sense. But I also think that I can see how people are being, the anger and that sense of betrayal and resentment can lead people to very dark places where they're still controlled by the very powers that they are trying to overcome. Does that make sense? And so I don't have the answer necessarily. I would like to explore that with people. How do you move forward so that you can stay clear-minded? You can stay clear-minded about this, and you're not still attached to these same people who screwed everything up, because you are constantly thinking about how much you hate them. Does that make sense? That's a very deep spiritual question that I really wonder, not just for this, but I've read a lot of great theologians, Miroslav Volf, for instance, and that was like his central question. He's Croatian, and he would ask, like, if his community, people who are slaughtered, he somehow had to look at them and say, if we can't move forward in forgiveness, they're going to go be retributive. And at some point when they gain the power, they're going to do the same thing. They're going to go slaughter a bunch of people who killed them. So how do I keep them from doing this? Like, what is the, if you want to read the book, it's great, but I wonder about that quite a bit. Before we go any further on that one though, Doug, let me ask you what your favorite wine is.
I wish I had my wife Karen here, because she could answer that question for me. She loves wine, and I am not. I am a teetotaler. So I guess if I had to choose one, I'm going to base it entirely on the label. I like the artistic nature of these labels. I'd probably be more of a red wine guy, because I like red meat. So yeah.
So that's good. We're trending in the direction of my wine, because they are red wines. They're Malbecs. If you all would like to support my work and you want 50% off some amazing wines, what's the next holiday? Memorial Day, and then Father's Day. So there's plenty. We're in holiday season for a little bit now. So get some AllisonWinePromo.com. Wait, I'm still showing AllisonMarrow.locals.com. That's also a great way to support my work. But if you want wine, go to Allison. I don't sell wine on AllisonMarrow.locals.com. But if you go to AllisonWinePromo.com, yeah, these are all high altitude, extremist altitude Malbecs. The one in the middle, 8,200 feet, 92-point Malbec. Can't get this stuff at the grocery store. One on the left, the Rogue Malbec. Come on, Doug. What goes better with what you guys are doing than the Rogue Malbec? It's one of my favorite Malbecs ever. Extremely limited production. They hand harvest the grapes for that one. The one in the middle, again, the 92-point Malbec, that is from the oldest vineyard in Argentina, over 200 years old. And the one on the right, zero filtration, natural fermentation, and named after the Cowboys of Argentina. So it's a great way to support my work if you're already a wine drinker. You can also get some amazing coffee at twinenginecoffee.com/Allison. These are USDA certified organic roasts. They've got light roasts. They've got dark roast. They've got medium roast. I drink the espresso. I'm a big raw milk latte drinker. My daughter, she likes to pretend that she sells things now. So she has got this little theater set. And in the morning, before she does like her production, she also sells coffee there. So I went up to it and I asked her for a coffee. Actually, I said specifically I'd like a latte. And she goes, "We don't have lattes." It's like total make-believe, but for some reason she doesn't have the one drink that she knows I have every morning. So anyway, she doesn't sell lattes. So don't go to her coffee truck if you want a latte. Anyway, this is what I drink with my lattes. It's very good. If you're a tea drinker, though, you can also get some Katura tea. It's very good. It's also like black tea. I cold brew mine. I've actually got a cold brew going right now, and it looks like this. See? It's like a black tea. It's very good. I add a little bit of sweetener, some lemon, maybe some honey, and you're off to the races for this summer. So thanks to my sponsor for sticking with me. All right, Doug, do you want to say anything about the spiritual stuff before I move on to my next thing that I was going to talk about, which is me actually asking a question, then watching the Department of Health, and we get to listen to it together?
I'd much rather talk theology with you. We should have a theology podcast together. But you're the host. I'm going to defer to you.
Okay. All right. Let's look at this real fast here. Okay. This is the, wow, hang on. Gonna bring it up. I just want to make sure I'm hitting the right thing here. Okay, good. Doug, will you let me know if you can't hear this? Okay.
Okay.
Okay. So just raise your hand because I'm going to mute myself. But if you can't hear it, raise your hand. This is the Washington State Department of Health media briefing. And this is, I'm like wondering, what are they thinking with Allison on the line here? So here we go.
This question comes from Allison Morrow with Morrow Media. Allison, go ahead.
Thank you. I have a couple related questions. The first is, what is the recommendation going to be for businesses and government agencies who still have vaccine mandates at this point? Also, mask mandate for healthcare centers. And can you explain it? Looking at the graph of the hospitalizations and deaths, it appears that the highest rate was in the January, February 2022 timeframe, which came a few months after a lot of the mandates were enacted, and then, several months after the vaccine rollout. Can you explain that as well, please?
Thanks, Allison, for that question. The last question related to the graph, I'll let Dr. Quanget process that, and Lacey and I can tag team on your first question. I think one of the things that we've made very clear is that we continue to support what's happening throughout our state when it comes to supporting or protecting health and well-being. And so when that means agencies or entities may require something, we will continue to support that. That is something that we have championed throughout the pandemic, and certainly even recently when the statewide requirements, for the most part, at least from a Secretary of Health standpoint, for masking requirements in healthcare facilities and other places that ended on April 3rd, we had that additional message, which was we would continue to support what was happening at a regional or a local or a facility standpoint from with respect to, in this case, masks. So we continue to have that same stance. We want to support what's happening at that local level, but also recognizing that we're at a different place as a state. And so depending on what those policies are from a state perspective, we're continuing to be aware of what's happening both at a federal level and then certainly what's happening at a regional or a local level. Lacey, anything you want to add to that?
I think what I'll add, in addition to local governments, businesses, healthcare facilities making choices based on their physical plant space, their risk, and the conditions at the local level, is that in Washington State, COVID remains a workplace hazard, and employers have a responsibility to protect their employees related to that. And so employers may choose to still require vaccinations or masks as part of their mitigation of COVID-19 in the workplace.
This is when I
Lacey,
went,
thank you so much.
wow, you didn't answer my question about hospitalizations and deaths. And it's like they knew.
Sorry to interrupt. We had a second question there that Dr. Quanget was going to answer.
Yes, I'd be happy to answer the question about the peak in hospitalization rates that was observed in January 2022. That corresponded to the advent of the Omicron subvariant, which was much more transmissible than prior variants, and also had a degree of increased ability to evade immunity from immunization and previous infection. So masks were an important tool of preventing spread in healthcare facilities. During that time, the spread of the SARS-CoV-2 virus was just so prevalent in the communities that resulted in the increase in hospitalization rates, despite the use of infection prevention measures in our healthcare facilities, including the use of masks. Thanks.
And then I had several other questions asked, but they moved on and then they never came back to me. No shock there. So, okay. So basically he's like, yeah, well, we just had this other variant. And, okay, so why did we still have a vaccine mandate? Can anybody answer that question for me? I mean, what I got out of that was they're basically like, yeah, we had this other variant and basically it evaded the vaccine. That's what he's saying himself. That's what, anyway, I have a poke holes in even just that argument, but okay, let's just run with that for a second. So he's saying that. So why do we still have a mandate? Or why are you saying you support employer mandates again? Like, we're now years past that original vaccine rollout. Why did we have the vaccine mandates at all if you're saying that your highest hospitalization and death rate was after the vaccine because the variant, anyway, I'm cutting the YouTube stream because you guys know where we're headed with this one. We'll see you over on Rumble, ROKFIN, or Locals. Have a great day.